friends on Facebook shared your post, like a couple bullet points and highlights about the vaccine. And it was at the same time that I was looking for someone to speak with about it. And so I was like, this is so perfect. And when I reached out to you, you responded instantly, which I was so surprised, but also really excited. So yeah, that's so the first question is, if you've already had COVID-19, do you have immunity? And if so, for how long?
Immunity, some of the questions here, phraseology is important and the precision of the words is delicate. We don't talk about these things in terms of immunity as much as we do in terms of risk reduction. And your immunity that's produced represents a risk reduction sufficient that we're comfortable saying that you should be safe to a 95% certainty for about the next 90 days. So if 95% actually still means that 1 in 20 individuals will fail. So there's no blanket immunity converted. If you have a normal immune response, then you should be comfortable for a 2 to 3 month period of time.
Okay. Is the side effect profile the same or similar for those two? And then also for those with pre-existing allergies, would they be more susceptible to the adverse side effect?
To the first part, that's a distinction without a difference. And in terms of individuals having a preference for one vaccine over the other on the basis of its safety profile, no, that's nothing that anyone needs to be concerned about. You actually should be promoting the opposite conversation with the 95% safety profile, success rate. People should be fighting each other to get to the front of the line when their number is called. Allergies are not the concern. Anaphylactic reactions are the concern. And basically when we talk about that, we're talking about the specific set of allergic reactions that cause respiratory distress, where you feel like your throat is closing and you can't breathe, etc. That's, that's the allergic reaction of consequence. Everything else is pretty irrelevant. There's a relatively defined risk profile, and it's really not qualitatively different than you would see with the flu vaccine or any other type of vaccine. You get local tenderness, redness, possibly swelling and pain at the site of the injection, and you might get fatigued and other such things, but none of that is, in my estimation, even worth mentioning. If you know what they are, if you know what to expect, then that will stop you from having an anxiety attack. But the side effect profile pales in comparison to anything that you'll have if you have the disease. I'm an emergency physician, and we always say, don't let the side effect get in the way of the potential life threat.
It's just asking if there are specific numbers or participants who are pregnant or immunocompromised.
According to the American College of Obstetrics and Gynecology, the answer is no. No one's going to do studies, and that certainly wasn't the first priority. However, ACOG actually suggests that if your indications are such that you are a candidate for the vaccine, a pregnancy status does not prohibit you from getting the vaccine, and it also doesn't prohibit you from breastfeeding. So pregnancy is an irrelevant consideration. However, because of the relative newness of all of this, there haven't been large-scale studies to wean that out. And the premise for that is pretty simple. We assign mysterious and magical traits to the vaccine, but flip it around from a science standpoint, what exactly is in the vaccine that would make you worry about it? I mean, there's nothing live in it. There's no virus in it. It basically is a constitution of salt water, lipid, and a piece of messenger RNA. So there's really nothing that one should be worried about in this example, and that'll be borne out subsequently on studies when they occur.
So the next question is related to the 2-dose regimen. So if someone gets the initial vaccine but tests positive within the 21-day time period, would they still get the second dose, hypothetically?
No. The way this works is that the goal is to generate an immune response, and that immune response can be generated either by contracting the infection or by getting the vaccine. If you are infected, as we pointed out, you have 90 days of presumed immunity, and that would rule you out. If you actually look at the example of prominent individuals such as Donald Trump who got the infection, one of the criteria for getting the vaccine is that you're 90 days out from an infection. So that's how that works.
Follow-up question to that. How long is the initial two-dose vaccination good for? Would there be a need to get another dose at some point in the future, like the flu shot?
The answer to that's definitely going to be yes. I actually, and again, this is not based on any science, just an educated medical thought, that I would have presumed that had we had hundreds of millions of doses available, since we're in the middle of a pandemic, then we very well may have seen a twice a year dosing regimen. However, the way that this is being situated is we're looking at giving it as early to the respiratory season as possible, respiratory season being the end of fall through the end of winter. Um, and the idea is to give you those 90 days of presumed immunity through the end of respiratory season. Now, the goal of immunizing you during that period is to knock the amount of virus that's in the population down sufficiently so that when the next respiratory season starts, you aren't trampolining off of the very top rung. And that's exactly what happened, which is why we didn't have 2 or 3 waves. We just had one big old wave with several peaks. So the idea here is that, yeah, in the best case scenario, you can just do the math, right? I mean, if you get immunized sometime at the beginning of respiratory season and it lasts you 90 days or so, then that's going to leave you exposed for another 180 or so days. But that coincides with the period of time where there shouldn't be much of the vaccine in the environment. As I suggested, if I had the keys to the car and hundreds of millions of doses, I would have, during the time of the pandemic, given a second dose 6 months after the first, and that would have gotten us completely through the pandemic. But because we're prioritizing it all, we're going to continue to ask people to utilize the other measures such as hand washing and masking and social distancing, et cetera, to make up for not being able to give the vaccine in more than 1 dose for the first year.
And the next question is related to what you were just talking about mask and washing hands. So someone asked, when can I stop wearing a mask and avoiding close contact with others after I have been vaccinated?
No such thing. Not gonna give you a waiver that says that you can go back to your past irresponsible ways if that actually was the case. The point is, as always, it's about risk reduction. So you can maintain a higher risk or a lower risk. It would behoove all of us moving forward to mask whenever we can't social distance. It's just that simple, whether you're talking about family or outside. If you can't social distance, you should have a mask. We should do a better job. We should have always done a better job at hand washing and sanitizing, especially if you're the type that likes to put your hands in your face, your eyes, nose, heaven forbid, and mouth. You should be sanitizing before you do that, and you should be sanitizing or hand washing after you touch anything that is potentially infectious. So instead of thinking about it in the way the question was phrased, think about it in terms of what can I do to continually lower my risk. You don't have to walk around all day, every day wearing a mask, although there are benefits to walking around all day, every day with a mask that markedly reduce your risk for influenza, markedly reduce the risk for real bad seasonal allergies, and it stops you from smelling bad things that are in the environment. So I'll leave you to imagine what those could be. But I'm on the side of maintaining as low of a risk as possible because expressions of disease are manifestations of risk. If you have the lowest possible risk, then out of 100 people, there'll be less incidences than if you have a high group population, and they'll produce more incidences of the risk. Lower your risk. Keep wearing the mask.
Okay. The big takeaway, keep wearing the mask. Next question is, will the vaccine be tested against the new mutated strains like the one in the UK, or have they already been?
Yeah, I mean, there are people out there that are going to do studies on any and everything, but we already know that all these 6 strains that are out in the population are susceptible to the mutations. And then remember, the way these mutations generally tend to work is that they don't produce bigger and badder pathogens. They actually are a little bit less lethal. So these strains aren't freeing the vaccine up. They're just trying to maneuver. So in this particular example, what we know about the European strain is that it actually transmits easier, but it isn't more virulent, and it isn't not susceptible to the vaccine. So all that means is that if you're not masking up and doing the other public health best practices, you're more likely to get it if you're walking around where that strain happens because it transmits more easily than some of the other ones that are over here in the United States. Keep in mind, this is in Europe. I don't know if anybody's traveling to Europe anytime soon.
Do you have any words of reassurance to those, especially in the Black community, who are on the fence about receiving the vaccine?
The reasons are for number one, Tuskegee, and number two, Henrietta Lacks, and number three, because Black women in particular have higher rates of infant mortality, and discrimination has been shown to be the case throughout medicine and science as applied to Blacks in particular, when you don't have culturally sensitive and specific physicians who administer care. So the point of all of that is that, let me talk about Tuskegee for just a second. People need to quit it. With all due respect, people need to get a clue. Tuskegee was the medical equivalent of a war crime. That is nowhere near the same as having a vaccine that has a 95% safety profile being administered to the general population, inclusive of African Americans. Completely different. So stop it with the false equivalence. Now, the equivalence may be false, but the concern is very real. And what I would tell to those people that have concerns is that what would actually make you feel better? You can't be governed by your fear. Okay? Fear is an irrational response or a rational response to a deadly threat. How would you get a level of comfort? Well, the truth of the matter is the reasons why physicians like me and aspiring physicians like yourself exist is so that we can have representatives in our community who both participate in research trials, oversee research trials, and report back on research trials. One of the very positive things about this is that there has been representation. You may be familiar that the African American female was very prominent in the development of the Moderna vaccine, and an African gentleman was very prominent in the development of the Pfizer vaccines. The National Medical Association, the oldest and largest group of Black physicians, representing over 50,000 physicians across the United States, in existence since 1895, has had a COVID-19 task force that has overseen all of this. So we have had all of the desired checks and balances in place on the front end to make sure that what's being reported cuts mustard. And I'm here to tell you that I came into this personally with a healthy amount of skepticism, and things are significantly better than I would have dared think. And so much so that I again suggest to our community that's disproportionately bearing the brunt of the disease. Again, this is a real threat, not a conceived or potential threat. We should be forcing our way to the front of the line, because a 95% success rate is much better than any conceivable or potential risk that's been expressed or is even theoretical. You know, you tell me, you ask your friends and ask your friends' friends when the last time was that they heard of someone dying from a vaccine. You know, it's too much. We're doing too much. And meanwhile, there are 340,000 people in the United States who have actually died. What are you afraid of? Why would you be afraid of something other than death? Okay, so trust your doctors. You know, I refer to us as the nerd group. You know, we've studied this our entire lives. We're reporting on it. We're strategically in all the right positions. And oh, by the way, if you go back to the Tuskegee syphilis experiments, IRBs, institutional review boards, were created on the back end such that those types of atrocities can never again occur. People were concerned about those experiments, but people don't pay attention to all the checks and balances that were put in place on the federal level afterwards to make sure that that never could happen again. And we have exerted oversight to make sure that our community is not being affected in the ways that people fear. So you can have your opinions, but that doesn't make them facts. And if you have fears, you know, combat those by information. And again, I don't want to be disrespectful to anyone's concerns, but if your fears are irrational, all you're really doing is hurting yourself. So seek out your medical friends and be guided by the facts, because in the meantime, COVID's out here and it's not waiting for you to get a clue about your fears. And we're dying. We need to be running to the front.
Thank you so much. This was great. I don't have any other questions for you. Do you have any questions for me?
No. People have short attention spans. It's good to get those questions out and to get it in, get it out. You know, what I just want to say to folks is that you're not taking this with the appropriate amount of seriousness. The one piece of advice I can give you, even more so than taking the vaccine, is whenever you cannot socially distance, wear a mask. It's just that simple. If you're within 6 feet of anybody doing any type of activity, if you work in the hospital and you go home and you have some people at home, pay attention to how close you are to people. If you're at the dinner table, then you have to eat. But other than that, you can do a better job at socially distancing, and try to put that into practice whenever you can. And when you can't, put on your mask. Who cares? Get us through this pandemic to where everybody's vaccinated, and then we can talk about revisiting somewhat a more normal life. But that's not where we are today.
I'll let you go. Thank you so much for this. This was really great, and I know people are looking forward to these answers.
Very good. Let me know if you have any other questions. All the best and study hard.
Thank you. Bye-bye.